Hello everyone. Very good evening to all of you. Am I audible? Hello. Yeah. I'm audible to all of you. Okay, ठीक है, चलो fine. Okay, see, we are going to discuss. We are going to have the clinical case discussion here. This CCD is actually clinical case discussion. Okay, so don't get confused. This is medical CCD. All right. Okay, fine. So, like every Sunday we are going to have the clinical case discussion. So this time we are going to solve the questions of anatomy, and next Sunday we will be having clinical case discussion of the pharmacology. Okay, so this time we are going to solve 15 or 16 question of anatomy. Next time super 30 question of pharmacology will be there, so that you should have good orientation about the clinical question. Because you know what, these days like even in MCI exam they are asking all the questions in a clinically integrated fashion, right? So I hope your preparation for the December FMGE exam is going on well. Yeah, but you should also have the orientation of clinical questions. Okay. So, okay, so let's start this session. First question for you people. Okay, see, first question. After the injury over right shoulder, a patient is avoiding abducting his shoulder because of pain. He has dull ache on his affected shoulder and has difficulty sleeping over the same shoulder. X-ray of right shoulder did not find any fracture. The clinician is doing the following test as shown in the photo. So which injury clinician is suspecting? So basically this is a question of the orthopedics. Okay, this is a question of the orthopedics, but like I have asked you this question like in an integrated manner. Orthopedics question, until and unless you don't know the basic anatomy, you will not be able to solve the question of orthopedics. Okay. So first of all, chalo, theek hai. I can see your answers here. I can see your answers in chat box. Dr. Sanjeev is writing A, Dr. Surya, Dr. Aishwarya Gupta, A. Okay, fine. Chalo, theek hai. Some more people. See, you can try. First of all, you tell me what is the diagnosis here. Like, you know what? Like, after the injury, patient is having pain. Okay, so whenever there will be pain and patient is not able to move his shoulder, like at that time, what will happen? Like any of the orthopedician, any of the clinicians, so they are going to take X-ray first. Okay, so like this is mentioned here that X-ray of shoulder did not find any fracture, but patient is having pain. So after that, you can see in this picture that clinician is trying to perform a test. Okay, see, like what is happening here? I'm asking all of you, see, like basically in the question, like this is mentioned about the right shoulder, and in the photo, this is actually left shoulder. Left, but we have to focus on the clinical part here. I'm asking all of you, okay, what you are going to do? Extend your arm. Okay, first of all, you do like this now. Extend your arm, and after that, you laterally, like internally, you move inside. And after that, you are going to keep the dorsum of the hand, okay, dorsum of the hand on your back part. And if you are able to do like this, okay, same like given in the picture. Okay. After that, I am asking you to lift off your hand. Lift off your hand from the back. And if you are able to lift off the hand, it means for like there is no any injury. There is no any injury in the Okay, like in a muscle or the tendon there. But if you are not able to lift off, so it means there is some problem, there is some injury in a muscle or the tendon. So basically, you know what, overall, what is the diagnosis here? Overall, the diagnosis is the rotator cuff injury. Overall, the diagnosis is the rotator cuff injury. So if I ask you some basic anatomy questions, how many muscles are there in the rotator cuff? Rotator cuff, this is a group of the muscles and tendon. I hope you remember the basic mnemonic. Sits, है ना? Sits सबको पता होगा, right? Sits. I'm talking about the rotator cuff, right? A rotator cuff. So this is a group of the muscles and the tendons, fine. So which is going to keep, okay, which is going to hold the ball of the humerus, okay, the head of the humerus into the socket of the shoulder, so that you should be able to move like this. Okay, now this is called the rotator cuff. Okay, 4. Okay, fine. So now, okay, sit. So what is the full form of this sits? Supraspinatus. All right, supraspinatus. Very good. I stands for infraspinatus. And what about the T? See, it is the T is the teres minor or teres major? It is the teres minor, right? Teres minor. And S stands for the subscapularis, right? Subscapularis. See, very good, very good. So this is the sit. So what is happening here? Whenever you are going to ask the patient to do like this, okay, no, so in this position, the most active muscle will be subscapularis. Most active will be subscapularis, and this test is called as the lift off test. Lift off test. Okay, no, lift off test. But this is also called as the Jorber's test. Right now, so what is happening whenever you are going to perform the lift off test? What is happening there? Like after that, you are going to assess the strength of the subscapularis muscle and if there will be a rupture in the tendon of the same muscle. Right now, so here answer will be what? Answer is D only. Answer is D only. Right? Very good. Very good. Okay, chalo, next question. Okay, fine. Next question is also very easy for you people. See, a clinician is going to inject local anesthesia as shown in the photo. Similar question I have asked you before also. Okay, that was clinical situation was related to burns like earlier when I asked. Right now, so this time I'm just asking you, one clinician is there who is going to inject the local anesthesia here. I know. So basically, you know what, like he wants to, like he tries to, see, in this clinical scenario, he tries to block a nerve. So what is your answer? ABCD? Median nerve, ulnar nerve, superficial branch of radial nerve, or the deep branch of ulnar nerve? And your answer is what? ABCD? Very good, very good. See, most of you are correct here. Very good. Most of you are correct. Simple thing is that, you know what, like whenever you have to operate in the hand, whenever you have to operate, okay, whenever you have to operate over the hand here, no? Okay, maybe, you know, like after RTA, or maybe if there will be burns case, or maybe any kind of wound infection will be there, or maybe, so you have to operate over the hand and you want to do the wrist block. So wrist block mein kya block karoge? First of all, you are going to block the radial nerve, after that median nerve, after that ulnar nerve. Okay, fine. See, you know what, like after blocking, after giving local anesthesia over the radial nerve, over the median nerve, over the ulnar nerve, patient will say, sir, I do not feel any sensation over the palm of my hand, but sir, I still feel some sensation over the dorsal part here, sir. Okay, no, so what is happening here? Say, it means what? Still you need to block one more branch of the nerve. So this part is being supplied by which nerve? Superficial branch of radial nerve. And I hope all of you know that superficial branch of radial nerve that will pass through a snuff box. And this part is what? This part is snuff box. Snuff box. Okay, superficial branch of radial nerve. Okay, see here. See in this same question. Okay, same question related to a snuff box. If I ask you, after the wrist injury, or maybe, you know, like after a kind of any trauma over the wrist, a clinician is, okay, you know what, like at that time patient is complaining that, sir, I'm having severe pain in my wrist, and clinician is going to palpate over the snuff box. And after that, whenever clinician is palpating over the snuff box, patient is screaming because of the pain. So now you tell me, okay, which fracture like he's suspecting here? The fracture of which bone? I'm talking about a snuff box, right? I'm talking about a snuff box. So I'm asking you, a clinician is palpating over the snuff box, and after that patient is having excruciating pain, severe pain he is having. So which bone fracture clinician is suspecting? Very good, very good, very good. Answer the scaphoid bone, right? Scaphoid bone, scaphoid bone. Okay, fine. Very good, very good, very good. Okay, next question. Okay, next question here. A patient has good language comprehension, but his speech production is impaired. His speech is slow, slurred, and non-fluent. Which part of brain is affected in this case? I think this is an easy question, and you can solve this question. A patient has good language comprehension. Basically, when I talk about the comprehension, this means what? Understanding of the language, right? Understanding, right? Okay. But his speech production is impaired. His speech is slow, slurred, and non-fluent. So I can say patient is suffering from non-fluent aphasia. Basically, patient is suffering from, okay, so non-fluent aphasia. Non-fluent aphasia. So now you tell me, so when I talk about aphasia, most of you might be thinking this is related to Wernicke's aphasia or the Broca's aphasia, right? Wernicke's and the Broca's. Now we have to differentiate all these points here. Okay, see, like in this question, I'm going to ask you multiple questions related to physiology and anatomy. Yeah, patient is having aphasia for sure. Patient is having aphasia, yes. But which aphasia you are suspecting here? A, B, B. I think most of you are correct in this question also. Okay, fine. Chalo, I'm going to ask you some more questions related to this topic. Okay, related to this topic, because this is the most important topic in anatomy of brain, anatomy and physiology also, from where every time you are going to one question for sure. Okay, chalo, so let's talk about, okay, let's talk about the Broca's and the Wernicke's part. Okay. Okay, chalo, I can see your answers here. Very good, very good, very good. Dr. Jubair is asking, sir, will you send this annotated PDF? This PDF will be shared for sure. Annotated, I'm not sure, but I will try to share with you all. Yeah. Okay, chalo, okay. Now I'm going to ask you some question. Okay, fine. Now let's talk about the Brodmann's area first. Okay, Brodmann's area, I'm going to talk first. Okay. Say, let's talk about the Broca's and the Wernicke's. Okay. Okay. Okay, my first question. The first question you tell me. Okay, so what about the Brodmann's area here? Area number. See, if I ask you about related, if I ask you related to Wernicke's and the Broca. So first of all, you tell me area number as per the Brodmann's area. What about Wernicke's? Okay, fine. This will be 22, right? This will be 22. And what about the Broca's? And what about Broca's? Very good. This is 44 and 45. Okay, chalo, this is, I'm asking you some question related to basic anatomy of the Wernicke's and Broca's. Okay, fine. Now you tell me, see, in which lobe you are going to see the Wernicke's area? See, in which lobe, like temporal lobe or frontal lobe? I'm asking you about lobe. Okay, fine. So Wernicke's you are going to see in the temporal lobe. In the temporal lobe. And what about the Broca's? Broca's you are going to see in the frontal lobe, right? Frontal lobe. Very good. Frontal lobe, right? Okay, chalo, fine. See. After that, if I ask you the exact location of the Wernicke's area, and if I ask you the exact location of the Broca's area, what is your answer? I'm asking you the exact location of the Wernicke's. Very good, very good. See, Wernicke's you are going to see at the posterior end, of where? At the posterior end of superior temporal gyrus. Superior temporal gyrus. Okay, superior temporal gyrus. Very good, very good, very good. What about the Broca's? And what about the exact location of the Broca's? Inferior frontal gyrus. Okay, no? Inferior frontal gyrus. Very good, very good, very good. After that, please understand some basic physiology. Suppose, you know what, like suppose if you are going to, okay, suppose if you are going to hear some words, okay, suppose if you are going to hear some words, okay, no? Okay, fine. So what your brain is going to do, your brain is going to interpret the, okay, your brain is going to interpret the language first of all. Okay, so first of all, there will be the interpretation of the language, interpretation of the words, okay, by secondary visual or the auditory areas of the brain. Okay, fine. After that, now you tell me, so first of all, like there should be the planning of words, and after that there will be delivery of word. So if I ask you one question, in which part of brain you are going to see the planning of words? I'm asking you, words planning kahan pe hoga, batao? Like in Broca's or Wernicke's? Basically, I'm asking you the planning of the words or the formulation of the ideas. Basically, I'm asking you the formulation of the ideas which are supposed to be executed, which are supposed to be delivered in the form of the language, in the form of the sentence. Okay, so words planning or the formulation of ideas will be, okay, that will be done in the Broca's part or the Wernicke's part. Very good. This will be done where? Okay, fine. This will be done in the Wernicke's part, right? This will be done in the Wernicke's, right? Okay, fine. Okay, fine. So after that, what is happening when, yeah, very good, very good. When the planning will be done, and after that, what is happening here? Ideas or the words will be expressed in the form of sentence. So basically now if I ask you, now sentence will be formulated. Okay, fine. Sentence will be formulated where? In the Broca's part, right? Okay, fine. So I can say here, idea is expressed in sentence, right? In sentence. Where, which part? Fine. This will be done in the Broca's. Okay, no, this will be done in the Broca's. Now you tell me what is happening here. Okay, the plan is going to be passed. Okay, plan is going to be passed from the Wernicke's to the Broca's via. Very good, very good. Arcuate fasciculus, right? All these are one-liner questions, right? No, all these are the one-liner questions. Now, if I ask you one more question here, that like if there will be lesion in Wernicke's area or if there will be lesion in the Broca's area, so what will be the problem? Okay, so like see, like in which lesion you are going to see fluent aphasia, or in which lesion you are going to see the non-fluent aphasia? Like in which lesion patient will not be able to speak out. Right now, so what is happening here? See, like in the Wernicke's area, when I talk about the Wernicke's part, and when I talk about the Broca's part, fine. So what is happening here? See, in the when I write here, whenever there will be lesion in the Wernicke's part, after that, what is happening here? There will be problem in the comprehension. There will be problem in the planning. Right now, there will be problem. There will be problem in the planning. After that, patient will be okay. Patient will be having something like word salad. I hope you understand word salad. Patient will be having word salad. But whenever there will be problem, okay, whenever there will be lesion in the Broca's area, patient will be having some problem in the motor speech part. Patient is not able to speak. So what is happening here? Patient will be having broken words. Okay, patient will be having broken words. Okay, no? Shall I find? So I hope all these points are very, very much clear. Dr. Divya Reddy is asking, sir, this is not visible, which you are writing. You are not able to see. So you can't see. No, actually, I've written so many things, but okay, just hold for a minute. It's not visible now. No, actually, what is happening here now? Just hold for a minute. I will check my internet connection. I will check my laptop here. Okay, fine. Wait. Screen share. Okay, wait. I think this is stuck. No problem. Anyway. वीडियो मेरा चेक करें वीडियो
सर वो फुल स्लाइड करना स्लाइड शो पे डालना
अभी
साउंड ऑन कर लो एंड स्टार्ट
now it's visible to you. Okay, all right, chalo, ठीक है. Now you can see my screen now, right? Okay, fine, chalo, ठीक है. Let's have a fast revision of this topic because this topic is very, very important. Okay, Wernicke's and the Broca's area. Okay, first of all, I asked you one question related to the Broadband's area. Okay, see, when I talk about the Wernicke, this is up to 22, and this is 44 and 45, right now? Okay, fine. And the exact location of the Wernicke, that is the posterior end of the superior temporal gyrus, and exact location of the Broca, this is what? Inferior frontal gyrus. After that, I have asked you that, okay, like suppose if you are going to hear something, right now, and after that your brain is going to interpret, okay, there will be interpretation of the words, right now? Okay, fine. So words planning, and after the whatever there will be planning of the words. Okay, see, first of all, there will be planning of the words, and after that there will be delivery of the words, right? Okay, fine. Okay, so the words planning will be done in the Wernicke's part, and after that, when a person is going to speak out, okay, now when there will be expression of ideas, that will be done in the broadcast part, right? All right. Okay, so now if I am asking you one question. Now I'm asking you one question. So whenever there will be lesion in the Wernicke's part, now you tell me whenever there will be lesion in the Wernicke's part, see, there will be problem in the, understanding of the language or the delivery of the language. Understanding में होगा या फिर speech में होगा, motor speech में होगा? I'm asking you, whenever there will be lesion in the Wernicke's part, right? Whenever there will be lesion in the Wernicke's part, at that time there will be problem. Okay, there will be problem in understanding. There will be problem in the comprehension. There will be problem in the, okay, there will be planning of the ideas, right? No, fine. So you know what, like patient will be speaking a lot, and you know what, like there will be something like word salad, right? Word salad, fine. But whenever there will be a lesion in the broadcast part, like at that time, what will happen? Okay, patient will not be able to speak out fluently. Okay, there will be broken words. Okay, broken words. He will be having very slow speech, right? Slow speech. So now you can understand each and every part clearly here. Okay, so what is happening here? Okay, see, now in this question, what I'm showing you here, I have asked you, the patient is having non-fluent aphasia. Non-fluent aphasia means what? Patient is having some problem in the broadcast area. Okay, so one or the two, you are going to answer me this one, right? No, so one or the C. Either there will be problem in the comprehension. This part is good. So I can say Wernicke's is normal. I can say Wernicke's is normal, right? No, but there is some problem in the broadcast part. So answer is B only, right? No, answer is B, right? Easy to understand. I hope this topic is clear to all of you. Please understand that. See, so many times whenever they are going to ask you a question related to Wernicke's area and the broadcast part, fine. So first of all, location they can ask, area number they can ask, exact location, and the lobe, the temporal or the frontal lobe. And after that, they can ask you in the physiology if there will be lesion in Wernicke's part, if there will be lesion in the broadcast part. So what kind of aphasia will be there, right? Now, easy to understand. I hope this is clear to all of you. I have discussed so many anatomical parts and the physiological points here. Okay, chalo, fine. Okay, very good, very good. Okay, next question for you. A mother comes with her 3-year-old boy. She's complaining that her boy has swallowed a coin. What is the most common location of obstruction you suspect in this case? And I think this is a very, very easy question. See, like even in a recent NEET exam, this question was like similar question was asked. And this is frequently asked question. If you know the basic anatomy of esophagus, if you know the basic anatomy of upper GIT part, you can solve this question very easily. Can you tell me the answer here? So what is the location? A, B, C, D. Very good, very good, very good. Can you tell me? Okay, fine. Some of you are answering A, very good, very good. Other people? You are writing B also at the level of arc of aorta. Okay, chalo, theek hai. Let's discuss some basic anatomical points about the GIT. Okay, let's talk about esophagus. Okay, let's talk about esophagus. Okay, fine. So first of all, you tell me how much is the length of esophagus? Length of esophagus कितना होता है बता दो. Basic question पूछ रहा हूं मैं. Easy question. Only 25 centimeter, right? Very good. Only 25 centimeter. Okay, fine. Okay. See, after that, as we all know that there are the 3 narrowing parts. Okay, there are the 3 constrictions over the esophagus, in the esophagus. Okay, fine. So what is happening here? So Very good, very good, very good. So now if I ask you first, the first narrowing, at which location you are going to see first narrowing and the second narrowing and the third narrowing? Can you tell me? Okay, fine. Very good. Very. See, the first narrowing we are going to see at which part? First narrowing, that will be at the beginning of the esophagus. At the beginning of the esophagus. Okay, now see the beginning of the esophagus. That is actually what? 𝗬𝗄𝗃 part. Okay, fine. Please understand that the beginning of the esophagus, that is the narrowest part of the esophagus, and that is the narrowest part of the GIT. So whenever there will be foreign body obstruction, or so whenever you are going to get a case like this, which I am showing you here, whenever you are going to get a case like this, no. So first of all, the first place and the most common place of the obstruction, that will be at the narrowest part only. Okay, no. So what is happening here? So the first part, that is, okay, this part, okay, at the cricopharynx. And second part, okay, see, what about the second narrowing part here? A and L, at the level of arch of aorta and the left bronchus, right? Arch of aorta and the left bronchus, fine. And what about the third constriction? What about the third narrowing? That will be at the diaphragm level, at the diaphragm level. Okay, no? So fine. Okay, see, I'm asking you one more question, that you are going to measure the length of the constriction, right? Okay, fine. Very good, very good. So you are going to measure the length of the length of the constriction part. So first constriction is at the beginning of the esophagus. Okay, fine. So now you tell me at how much distance you are going to see the first constriction from the outer part of the oral cavity. और इसका लैंडमार्क कौन सा रखते हैं? कहां से मेजर करते हो बताओ? Upper part of incisor or the lower part of incisor? Very good, very good. Upper part of the incisor से measure करते हो, तो first यहाँ पे आएगा 15 सेंटीमीटर पे आएगा, right? After the second आएगा 25 सेंटीमीटर पे, right? यहाँ पे अगर दो को डिवाइड में करोगे 27.5 पे भी आता है, and the last constriction will be at the 40 centimeter. Easy to understand? Okay, fine. So basically, when we are going to solve this question, so here in this question, answer will be A only, right? Answer will be A only. Okay, now fine. Okay, see, so this kind of question was there in the recent exam of the NEET PG, and you know what, like this kind of radiological image was there, and after that they asked, they asked a similar question, and there was radiological image, and whenever you are going to see this kind of, okay, see, whenever you are going to get this kind of case, first of all, very good, very good. I can see your answer. Very good. I can see your answers here. Okay, so now if I ask you one more question, if I ask you here. See, whenever you are going to get this kind of case, what is the first investigation you are going to do? First investigation which should be done? Very good. First, always understand that whenever you are going to get this kind of the case, okay, first investigation which should be done, that is called the X-ray. Now, X-ray in which view? AP view, first of all, AP view, and after that, lateral view. After that, lateral view. Okay, no? So that you can make it clear that, okay, so that you can find out the exact location of the obstruction. You also have to find out whether, okay, whether obstruction is in the esophagus or the coin is lodged in the esophagus or in the trachea. So on the basis of the location, on the basis of the X-ray, you can find it out. Okay, no? Chalo, fine. Okay, next question. A patient complains of having flushing and sweating over the cheek after eating. He has history of surgery of the parotid gland few days before. Which of the following nerves can be associated with this condition? And what is your answer? Very good, very good. A patient complains of having flushing and sweating over the cheek after eating. He has history of surgery of the parotid gland few days before. Which of the following nerves can be associated with this condition? So basically, if I ask you first question, what is the diagnosis? What is your answer? Can you tell me the diagnosis here? Can you tell me the diagnosis? Okay, fine. This is a case of, okay, fine. This is a case of the 𝗲𝗏 syndrome, right? 𝗲𝗏 syndrome. This is a case of the 𝗲𝗏 syndrome, right? 𝗲𝗏 syndrome. I hope you know this case. 𝗲𝗏 syndrome. Doctors are very good, very good. 𝗲𝗏 syndrome, right? What is happening is, see, earlier this question was earlier this question used to be asked in a direct manner. Which nerve injury is seen in 𝗲𝗏 syndrome? Or 𝗲𝗏 syndrome is because of injury of the which nerve? Earlier it was like that. But now, see, now in upcoming exams, they are going to ask you in a clinically integrated manner. They will be asking you, okay, a person went through surgery over parotid gland. Okay, now after that he was discharged from the hospital. Now again he came to the OPD. Now he's complaining, sir, you know what? After this surgery, this is the complication. Whenever I'm going to eat anything, no, I will be having sweating over the cheeks, over the lateral part, over the mandible part. Right now, so what is happening here? Okay, so please understand that which nerve. Okay, which nerve might have injured? Please understand that whenever there will be surgery over the parotid gland, so as per the division, as per the branching of the nerves, you should understand that which nerve is passing through the parotid gland overall. This is what? Oroculotemporal nerve. Oroculotemporal nerve. Oroculotemporal nerve. Answer is B only, right? Okay, so please understand that what is happening here. Okay, this is the case of the 𝗲𝗏 syndrome, right? This is the case of the 𝗲𝗏 syndrome. All right, chalo, very good, very good. You people are performing so good. Okay, next question. Okay, find out the wrong match related to cranial nerves. And this is, I think this is a case of the one-liner question of the anatomy. Okay, this question, so this question is actually one-liner. You should understand and you should solve it one by one. See, option number A, the nerve most commonly involved in raised intracranial tension is abducent. Okay, and what about the largest and the thickest? This will be the, and this is the fifth nerve. Okay, which is involved in the basal skull fracture, facial nerve. Okay, and what about the nerve? And what about the commonest, this nerve actually which is being affected in spinal anesthesia? Is it oculomotor? Is it oculomotor? Basically, you have to find out the wrong match here. Okay, the wrong match you have to find out. So can you answer me? A, B, C, D? I'm asking you a question related to the cranial nerves, right? Cranial nerves. See, most of you marking D answer, and D is the right answer. See, this is a wrong match, but now I'm asking you which nerve is most commonly affected in spinal anesthesia. I'm asking about the cranial nerves only, right now. Which one? Very good, very good. Abducent nerve, abducent nerve, abducent nerve, sixth nerve, right? Abducent. Abducent nerve is most commonly affected in spinal anesthesia. So answer is D here. D is the wrong match. Very good, very good, very good. Okay, fine. Next question for you people. A patient came with inability to move his fourth and fifth finger. Okay. On examination, he was not able to hold a piece of paper between his fingers. Injury of which of the following site is most probable cause for his condition? See, this similar question was asked in AIMS. And I think in August exam, last August exam, this was the, there was similar question that was asked in FMG also. Yeah, but in that question, it was shown like there was a picture of a man, there was a picture of a boy basically. And after that, there was point, like that pointed towards the, this part here, okay, this part. And after that, they asked like there was the injury of this part, which nerve is most commonly injured here. So what do you suspect here? Overall, what is the diagnosis here? What is the diagnosis? Okay, first of all, he is not able to move his fourth and fifth finger. Fourth and fifth. So I can suspect that a nerve which is supplying these two fingers, okay, this nerve is being damaged here. Okay, fine. After that, when Okay, being a clinician, if I'm going to do the examination, like I'm going to keep a piece of paper in between the fingers, basically you can say, okay, like if I'm going to keep a card, so I can say whenever I'm going to perform a card test, after that patient is not able to hold the piece of the paper like this, and इसमें hold नहीं कर पा रहा, तो basically what is happening here? Basically what is happening here? Inability of adduction and abduction of the fingers, which is being supplied by the deep branch of the ulnar nerve. So basically overall there is injury of ulnar nerve. So now you tell me A, B, C, D, which part of bone will be damaged? After that there will be damage of ulnar nerve. Which one? A, B, C, D? Lateral epicondyle or medial epicondyle? Very good, very good, very good. Whenever there will be, so here answer will be what? Answer will be C only, right? Answer will be C. Means like whenever there will be injury of the medial epicondyle, right? Medial epicondyle. So this part, whenever there will be injury of this part, and after that there will be injury of ulnar nerve, right? Answer is C only. C. Okay, easy to understand. Very good, very good. See, these kind of questions they are framing these days. All right. Chalo, next question. Which of the following is a right match related to the taste sensation in the given image? See, I am asking about the taste sensation. I'm not talking about the general temperature and pain. I'm asking you specifically related to taste sensation. Basically, like in this question, you can see here the picture. This is a picture of a tongue, right? So can you answer me this question? I hope this is a very easy question for you people. Yeah, but options which I have given here, these options are confusing. एक बार देखो, सोचो और इसको solve करो. Easy question, but you have to be careful. See, I'm not talking about the wrong match. I'm talking about the right match, right? I'm asking you about the taste sensation, right? Taste. ऑप्शन से मैंने कुछ नाम को थोड़ा बहुत ऊपर नीचे कर दिया है, देखो चेक करो. एक चीज तो सबको याद होता ना, एंटीरियर 2/3 and the posterior 1/3 and then posterior most, right? Posterior most part, right? Posterior most part. Okay, fine. So what is happening? See, if I ask you what about the taste sensation of the anterior 2/3, batao. Anterior 2/3 is supplied by anterior 2/3 is supplied by I'm asking about the taste sensation. Can you answer me this one? Anterior 2/3. Yeah, this is supplied by chorda tympani. Okay, this is supplied by the chorda tympani, and this is a branch of facial nerve. No, this is a branch of facial nerve, right? Facial nerve. This is a branch of the facial nerve, right? Okay, fine. What about the posterior 1/3? Posterior 1/3 is supplied by the glossopharyngeal, right? Posterior 1/3 is supplied by the glossopharyngeal nerve. And the most posterior, the posteriorly most part, this is supplied by the vagus nerve, right? And this is supplied by the vagus nerve. And the vagus nerve mein kaun sa? Internal laryngeal branch, right? Internal laryngeal branch of the vagus nerve. So now you tell me which one is the right match here? Which one is the right match? One, जो इसमें वन मेंशन किया है, तो वन का मतलब यहाँ पे ये तो ग्लोसोफेरेंजियल से होना चाहिए था, राइट? नहीं, ये sorry, not glossopharyngeal. Like this should be supplied by chorda tympani. Okay, so 1 and the 3, and this is the branch of facial nerve, right now. So overall, I can see only this part is there. This is the right match here, right? Hannah, easy to understand? Fine. So answer will be C only. Okay, fine. Next question. Next question. While doing thoracocentesis, it is advisable to introduce needle along upper border of the rib, lower border of the rib, in the center of the intercostal space, or in anterior part of the intercostal space? Can you answer me this one? Suppose if I'm making a rib like this, okay, these are the ribs. And this is first rib, second rib, and the third rib. I think this question I have asked you before also. So what is your answer? I'm asking you while doing thoracocentesis. What is the meaning of the thoracocentesis? Means whenever you have to, okay, whenever you have to remove the water, whenever you have to drain out the water or air from the pleural cavity, lungs se agar nikalna hai na, around the lungs, if you have to drain out the fluid or air, fine, you are going to insert a needle. Fine. So whenever you are going to insert a needle, you should be very, very careful, because, okay, you have to be very, very careful so that you should not be, okay, so that you are not going to damage the neurovascular bundle. And I hope you know the location of the neurovascular bundle. That is at the lower part. That is at the lower part of the rib. Yahan pe hota hai na wo, right? So agar lower part of the rib mein neurovascular bundle hai, to at the lower part of the rib, you are not going to insert the needle for sure. What is happening here? You are going to insert the needle at the upper border of the rib. Upper border of the rib. Okay, no? See here. यहाँ पे ये जो रिब का फोटो देखो, छोटा सा दिख रहा है यहाँ पे, जो इसके लोअर पार्ट में. Okay, we can solve here itself. Okay, fine. See, whenever we are going to inject, whenever we are going to insert the needle for the thoracocentesis, I should insert at the upper border of the rib. यहाँ पे करना होगा, so that we are not going to damage, so that we are not going to damage the neurovascular bundle. Answer is A. Answer is A only. Fine. But see, like in this same question, if I ask you one more question here, if I have to do intercostal block, means whenever I have to insert, whenever I have to inject the local anesthesia. Now for the local anesthesia, I am going to insert the needle at the upper border of the rib or the lower border of the rib. Means for the blockage of the intercostal space, for the blockage, whenever we have to perform the thoracocentesis, we are supposed to give local anesthesia also, no? Right now, so now you tell me, for the local anesthesia, we are going to inject the needle at the upper border of the rib or the lower border of the rib. Right now, for the blockage, we have to inject at the lower border of the rib. And please understand that, okay, see here, like in the case of the intercostal space, nerves, जो नर्व होता है सबसे नीचे में होगा यहाँ पे, ठीक है ना? फाइन. तो अगर मैं कहूं कि इंटरकोस्टल ब्लॉकेज है, राइट नो, इंटरकोस्टल ब्लॉकेज के लिए एट द लोअर बॉर्डर ऑफ द रिब, यहाँ पे ब्लॉक करने के लिए. ओके, फाइन. बट व्हेनेवर वी हैव टू परफॉर्म द thoracocentesis, we have to go for this one. Okay, na? I hope this is clear to all of you. See, all these are basic clinical practice, but all these questions you are able to solve on the basis of your knowledge of basic anatomy. How to execute the knowledge of your basic anatomy, you should be able to execute it. Okay, chalo fine. Next question for you people. Okay, now this question, I think so many times I have asked you this question. Clinician is trying to auscultate which valve here? ये बेसिक ये चीज तो सबको, जो भी जूनियर डॉक्टर है, सीनियर डॉक्टर, हर किसी को करना है ना, ये तो ऑस्कल्टेशन everyone has to do, right? है ना? So now you tell me, as per the location of his stethoscope, so which valve here? This question I have asked multiple times, like in last sessions also. ओके ठीक है, आई एम गोइंग टू मेक 4 वॉल्व्स here. चलो ठीक है, मैंने एक यहां बनाया, यहाँ पे दिस पार्ट इज द स्टर्नम पार्ट. ओके, दिस पार्ट इज द स्टर्नम. एक मैंने यहां बनाया, एक यहां बनाया, एक यहां बनाया, एक यहां बनाया. ओके, नाउ यू टेल मी, है ना, दीज आर द 4 वॉल्व्स. वॉल्व्स का लोकेशन है, ठीक है. ओके, नाउ यू टेल मी, ओके चलो एक बार रिवाइज करो मेरे साथ में, ठीक है ना, एक बार रिवाइज करो. All of you are going to revise it with me. Okay, see, first of all, you touch your clavicle. First of all, you touch your clavicle. Okay, first of all, you touch your clavicle, all of you. Okay, whenever you are going to touch your clavicle, just behind the clavicle, you are having first rib. Okay, no? After that, when you go down, you are going to get a space that is the first intercostal space. After that, you are going to get the second rib, and after that, you will be having second intercostal space for sure. You can understand this point. See, like in between, we are having a sternum. Okay, now see, in between we are having a sternum, right? Okay, fine. So what is happening here? See, exactly in the second intercostal space, at the right border of the sternum, you are having what? Aortic valve. Right intercostal space, you are having aortic valve. Second intercostal space, exactly at the border of the sternum, in the left second intercostal space, you are having pulmonary valve. Okay, no? Fine. And after that, you go down in the left side of the sternum itself, fourth intercostal space, you are going to have which valve? Fourth intercostal space, you are going to have? Very good, very good, very good. Fourth intercostal space, you are going to have the? Bolo? फोटो देख के तो बता दो. Left side, fourth intercostal space, you are going to have the tricuspid valve. And after that, you touch your left clavicle, mid-clavicular line, you just go into the fifth intercostal space, right? No? Okay, see, ideally it is being said that just above the nipple, there you are going to have the mitral valve. Okay, no, fine. So here in this question, what do you suspect here? I am suspecting here what? यहाँ पे देख के लोकेशन बताओ. इसमें लोकेशन है fourth intercostal space, left border of the sternum. This is the tricuspid valve. Okay, चलो ठीक है, दोबारा एक बार कहते हैं, ठीक है ना? अगर मान लो कि सी, I'm going to ask you one question. If I'm going to keep my steth here, अनित स्क्रीन में देख करके मुझे बताओगे, ठीक है ना? I'm going to demonstrate here itself. Steth है यहाँ पे क्या अंडी भाई? Steth and down. Leave it. No, okay, leave it. Okay, fine. चलो ठीक है. You answer me now. So this is the sternum part. यहाँ पे sternum रख लो, है ना? बीच में sternum है. Okay, fine. Suppose if I am going to keep my stethoscope here, which valve बताना यहाँ पे कौन सा valve होगा ये? Which valve? See, this is left part, this is right part. अब बताओ यहाँ पे second intercostal space, यहाँ पे मैंने steth रखा है, यहाँ पे. Which valve? This is the pulmonary valve, right? Okay, fine. ये बताओ अगर मैंने यहाँ पे steth रखा है, यहाँ पे. Here I'm going to keep the, here I'm keeping then aortic valve, right? Aortic valve. What about this one? यहाँ पे mid-clavicular line, fifth intercostal space. यहाँ पे this one will be the mitral valve, right? Mitral valve. Okay, what about this one? Fourth intercostal space at the left border of the sternum. This is what? This is the tricuspid valve. I hope this is clear to all of you. Very good. Okay, fine. Next question. A person is diagnosed by upper respiratory tract infection. Which of the following structure may not be involved? Very basic clinical question. Very good. अब बताओ ये क्वेश्चन बताओ, तो बहुत ही इजी क्वेश्चन पूछ रहा हूं मैं अब, राइट? A person is diagnosed by upper respiratory tract infection, URTI. Which of the following structures may not be involved? I'm asking about URTI. upper respiratory tract infection. Upper respiratory, I'm asking you. I'm not asking you about lower respiratory tract infection. No, I'm asking you about upper respiratory tract infection. If you understand the basic anatomy, how many structures, how many structures are coming in the upper respiratory tract and which structures are classified as the structure of the lower respiratory tract, right now? So nasal cavity, sinuses, what about the larynx? See, like if you are going to start from the nose, if you are going to start from the nasal cavity, see this picture, you will be having more clarity. You start from the nasal cavity, you go up to larynx. This part is considered as upper respiratory tract. And after that, below the larynx, below larynx, all the structures of the respiratory, that will be considered as the lower respiratory tract. Okay, no, so what is happening here? So here answer will be what? In this question, answer will be trachea. An easy question. No? Now, if I ask you one question, a patient who is having asthma, so this will be upper respiratory tract infection or lower respiratory tract infection? I'm asking you, a patient who is having asthma, so this will be considered as, this will be considered as the pathology of the upper respiratory tract or the lower respiratory. Or when I ask you, like if a person who is having emphysema, or if I ask you if a patient who is having the bronchitis, or if a patient who is having the bronchiectasis. So these are the pathologies of URTI or LRTI. All these are related to the LRTI. Okay, but when I ask you, what about the common flu? See, if I ask you, what about the sinusitis? अगर मैं क्वेश्चन पूछता साइनोसाइटिस होता बहुत ही कॉमन है ना? अगर मैं पूछता साइनोसाइटिस है किसी को, राइट है ना? अगर मैं पूछता कि फेरिंजाइटिस है किसी को, राइट, फेरिंजाइटिस है, कॉमन कोल्ड है, साइनोसाइटिस है, राइट नो? सो ऑल दीज बिलोंग टू URTI then, right? No, all these belong to URTI. Very good, very good. Next question for you people. Okay, see, after the dissection of gallbladder from a patient of gallstone, gallbladder is sent to histopathology lab. On histological studies, epithelium was found to be tall columnar epithelium. What is the interpretation? See, whenever you are going to operate for the gallbladder stone, whenever you are going to operate for the gallbladder stone, after that you are going to send the gallbladder to the pathology lab, okay, because you are suspecting, you want to confirm that, okay, patient is having, okay, patient may have the risk of the carcinoma or not. Okay, that's why every time you are sending, okay, see, in all cases of gallbladder stone, whenever you are going to remove the gallbladder, no, you are going to send it to pathology lab. Okay, maybe like if there can be any risk of the carcinoma in future. Fine. After the report came, report says that, okay, gallbladder had the tall columnar epithelium. So what is the interpretation here? Like there is the carcinoma or benign cells or cholesterolosis is seen, and this is a normal gallbladder. I hope you remember the first year histology of gallbladder. The gallbladder में कैसे होते बताओ? Columnar epithelium with brush border. Easy to understand? So answer is, this is completely a normal gallbladder. Similar question was asked in AIIMS. And this kind of question you can expect in your upcoming exam of MCI. Next question, which of the following muscle is involved in movements from sitting to standing position? ये तो बता दो, lower limb basic anatomy. Which of the following muscle is involved in movements from sitting to standing position? Gluteus maximus, minimus, medius, or other muscle? Very good, very good. So can you answer me this question now? है ना, इजी क्वेश्चन है। मैक्सिमस का काम क्या बताओ, ग्लूटियस मैक्सिमस का काम क्या बताओ, कौन सा एक्सटेंसर, कौन सा ये सब है। आई होप यू रिमेंबर द बेसिक एनाटॉमी ऑफ योर लोअर लिम्ब। Please understand that gluteus maximus, okay, this is used as an extensor of the trunk on thigh. Okay, so what is happening here? Okay, so this is the muscle. Okay, this is the gluteus maximus, which is going to help you, help you in standing, right? Very good, very good. Next question for you. A patient presents to the emergency department with severe complaint of pain going down the leg from the lower back. She has the history of intramuscular injection at the gluteal region by an inexperienced healthcare worker. So basically, I can suspect this is what? I am intramuscular injection injury. Okay, no? Now, can you tell me? This is a frequently asked question ki whenever there will be, okay, whenever there will be intramuscular injection and that is being performed at the wrong location, right? At the wrong location. So now after that patient is complaining of severe pain, right? So which nerve injury might have done there? Okay, चलो ठीक है, ये anatomy question तो हम लोग करेंगे सॉल्व, लेकिन उससे पहले बताओ basic question. Like suppose if I'm going to make this is one buttock, right? Okay, fine. I'm going to make a quadrant, right? I'm going to make a quadrant here. Okay, fine. Now you tell me this is upper outer quadrant, upper outer upper medial. I would say this is medial part, right? No? Okay, medial. And this is the right buttock. So now you tell me this is 1, this is 2, and this is 3, and this is 4. In which quadrant you are going to give the intramuscular injection? In which quadrant you are going to give the intramuscular injection? 1, 2, 3, 4. नहीं, मैंने क्वाड्रेंट यहाँ पे बनाया ना, 1, 2, 3, 4 में बताओ कौन से लोकेशन पे इंजेक्शन दोगे इंट्रामस्कुलर इंजेक्शन? ओके, वेरी गुड, यहाँ पे दोगे ना, है ना? ओके, फाइन. Now you tell me, see what is happening here, like in the upper outer part of the buttock. Okay, you can see the gluteus maximus also, gluteus medius also. So now you tell me which one is safe, gluteus maximus or medius? Answer me, please. This is the basic clinical practice. Which one is safer zone, gluteus maximus or medius? As per the location of this muscle, you can answer me now, right? चलो ठीक है, देख लो, समझ जाओ इस चीजों को. See this part here. This part is the medius part, and this part is going to cover by the gluteus maximus. So if I ask you which part is safe, safe is the gluteus medius only. Okay, safe is the gluteus medius, right? Safe is the gluteus medius. Okay, fine. After that, now suppose if a doctor is there who is not so much experienced and who is going to give injection, either a doctor or maybe a nurse or maybe any practitioner. Okay, now suppose if he's going to inject here. Okay, suppose if he's going to inject here. Okay, in this part, please understand that यहाँ से कौन सा nerve निकलेगा? sciatic nerve. ठीक है ना? Sciatic nerve, right? Sciatic nerve. So patient after that, whenever there will be injury of the sciatic nerve, patient will be having severe pain. Patient will be having what? Sciatica. Sciatica. Please understand what is the most common cause of the sciatic nerve injury. This is the misplaced intramuscular injection. See, like there are some other conditions also where there will be the injury of the sciatic nerve, like whenever there will be fracture of pelvis for sure, and whenever there will be posterior dislocation of the hip. है ना? See, in all these conditions, there will be what? Sciatica. Patient will be having what? Sciatic nerve injury. Patient will be having what? Severe pain. Right now? Okay, fine. Now, if I ask you one question, that intramuscular injection, safe area will be gluteus medius or maximus. It is medius. It is gluteus medius. Fine. No? After that, like, what is the alternative place of injection? That is actually what? The lateral aspect of thigh, vastus lateralis, right? All these are the basic clinical questions based on your basic anatomy. I hope this is clear to all of you. Okay. Yeah. So see, in this question, answer is C only. Sciatic nerve injury, right? Sciatic nerve injury. Very good. Okay. Next question. Okay, fine. Next question, you should answer me this question. After an RTA, after road traffic accident, a 43-year-old male is brought to emergency room with swelling and severe pain below knee. Doctor is doing peripheral vascular examination to check the pulses of which of the following artery. Can you answer me this one? This is a very easy question and interesting question. Obviously, this is a case of orthopedics, right? Yeah, but on the basis of the location, you can answer me the anatomy question. On the basis of the location, that's it. See, please understand that whenever there will be road traffic accident of the lower limb, no, and after that, when patient is not able to walk, when, okay, you are, as per the clinical scenario, as per the clinical condition, when you suspect that there is fracture for sure, there is fracture for sure, and see, like at that time, like suppose if there is a closed fracture, right? A closed fracture, you cannot see any wound outside. After that, when patient is not able to walk, when patient is not able to keep his, okay, to keep his foot on the ground, on the floor, then you are suspecting there is fracture for sure. Okay, you are going to palpate. You are going to palpate over the dorsum part, okay, over the dorsum part of the foot and just below the medial malleolus, and just below the medial ankle. Okay, now fine. So why? Because you are going to check the pulses over there, because you know whenever there will be closed fracture, you are suspecting that there can be the injury of vascular bundles also, there can be injury of blood vessels also. Okay, now suppose if you can feel the pulses, it means vascularization is normal. This is called a what? This is called a peripheral vascular examination. So as per the location, यहाँ पे कौन सा artery का pulse check करोगे? Yeah, here. Very good, very good. Here you are going to check the 𝗙𝗵𝗵𝗺 artery, 𝗙𝗵𝗵𝗺 artery. But when I ask you, when you are going to palpate over the medial malleolus, just below the medial malleolus, ankle part होता है ना, ankle part जो है ना, तो उसका जो medial ankle के नीचे में अगर करते हो palpate, तो कौन सा करते हो वहां पे? Very good. Answer me, please. Okay, chalo, ठीक है. We are going to discuss it in like in more detail. Okay, fine, chalo. Posterior tibialis artery, right? Very good, very good. Chalo, ठीक है. Okay, see, like this same clinical scenario, I am going to ask you some more questions related to this clinical scenario. Okay, no? Okay, same clinical scenario, RTA case is there. Okay, you are suspecting that patient might be having closed fracture because patient is not, okay, patient is not able to keep his foot over the ground, right? No? So now I'm asking you some more question. Okay, see, what is the first investigation to be done in this case? Dr. 𝗵𝗿liche, we can conduct, see, like, every Sunday we are going to keep classes like this. Okay. Okay. So now you answer me this one. What is the first investigation to be done in this case? बहुत ही इजी क्वेश्चन, ये तो बता दो, बेसिक क्लिनिकल क्वेश्चन आई एम आस्किंग यू, बेसिक क्लिनिकल क्वेश्चन। क्या करोगे पहला केस बताओ, सोच के बता दो थोड़ा। सी इवन इफ यू आर इन सेकंड थर्ड ईयर, नो यू शुड बी एबल टू सॉल्व दिस क्वेश्चन। मीन जब भी whenever you are suspecting that patient might be having, okay, patient is having fracture, right? CXR है ना, बेसिकली एक्सरे करोगे ना, है ना, एक्सरे करोगे, राइट, है ना, एक्सरे है, राइट। तो ये बताओ कि एक्सरे का क्या होगा, व्यू कौन सा होगा, एक्सरे का कौन सा व्यू करोगे। देखो, फर्स्ट ऑफ ऑल यू आर सस्पेक्टिंग दैट देयर इज अ फ्रैक्चर ऑफ द लेग बोन, यू आर बिलो नी, आई हैव like in the question I have written here कि below knee, है ना, below knee you are suspecting there can be the fracture of tibia or fibula. Long bones are there, है ना, long bones you are suspecting, so you are going to give which type of x-ray, AP oblique or AP lateral, AP oblique or AP lateral, AP lateral or AP oblique, AP oblique. AP means anterior posterior view and the lateral view, O means oblique view. तो ये केस में क्या करोगे, एपी लैटरल करोगे या एपी ऑब्लिक करोगे बताओ। See, always remember, always remember that whenever there will be long bones, whenever you have to take the x-ray of the long bone, no, whenever you have to take the x-ray of the long bones, right, like जैसे मान लो रेडियस अल्ना बोल दूं या ह्यूमरस बोल दूं, है ना, जब भी लॉन्ग बोन्स होगा तो एपी लैटरल, ओके ना, एपी लैटरल। बट व्हेनेवर आई एम गोइंग टू टॉक अबाउट जॉइंट्स बोलूंगा, अगर रिस्ट जॉइंट है या फिर एल्बो है, व्हेनेवर वी आर गोइंग टू टॉक अबाउट द जॉइंट्स, राइट, एट दैट टाइम एपी oblique, AP oblique. Easy to understand this. Okay, this is the basic clinical practice which you should know. Okay, chalo, fine. Yeah, so the first investigation to be done is what? The first investigation, x-ray of leg, AP lateral view. Okay, fine. After, what is the first line of management? Can you tell me, second question, what is the first line of management in this case? First line of management. Always understand that whenever you are going to get any case of the trauma, you have to follow what? ABC, ABCDE, है ना? ABC तो ABC, whenever you are going to get any case of the trauma, even if there is a closed fracture, where, like, suppose if there is a case of the pelvic fracture, history of fall is the pelvic fracture, कुछ भी close है, you don't know that, right? You don't know that. Fine. So like, say there could be internal bleeding. So please understand that always start with airway, breathing and circulation. Fine, no? Okay, fine. After that, when you see here that airway, bleeding, circulation, everything is fine. So what is the first line of management? You are going to do what? After that, you are going to do what? Immobilization, right? Immobilization. Fine, no? Okay, fine. Immobilization. After that, basic most question. What is the first medicine to be given here? बिल्कुल फर्स्ट ईयर क्लिनिकल प्रैक्टिस क्वेश्चन मैंने पूछा, फर्स्ट मेडिसिन टू बी गिवन, कौन सा मेडिसिन दोगे यहाँ पे, ये वाले केस में जहां पे मतलब पेशेंट को देख रहे हो फ्रैक्चर, बहुत ज्यादा पेन है। Of course you have to give the analgesic, no? Of course you have to give what? Analgesic, right? No? IV line में फिक्स करके कौन सा दे दोगे यहाँ पे डाइक्लोफेनेक इंजेक्शन you have to give, right? Easy to understand. All these are basic questions. Fine. Okay, chalo now. So after that, when you have done, okay, see, like first investigation, that is the X-ray, and after that you are seeing this kind of fracture. This is a multiple fracture, comminuted fracture, right? Okay, tibia and fibula. This is a closed fracture, fine. So and after that, you are going to apply only plaster. You have to, okay, see, after that you are going to apply only plaster of Paris, or you have to operate this case. ये X-ray देख के क्या लग रहा है, सर्जरी की जरूरत है या सिर्फ प्लास्टर लगा के भेज दोगे पेशेंट को घर? Are you going to operate, or only reduction is enough? No, of course you have to open the case, and after that you have to do the fixation. Fine. यहाँ पे plating करना पड़ेगा इसमें, right? Plating you have to do, right? And operation is must here, right? Operation is must, right? Okay, fine. Okay, चलो ठीक है. यहाँ पे same question पे आ जाओ. देखो यहाँ पे मैंने question पूछा. This is related to road traffic accident, right? No, this is related to, okay, this is related to road traffic accident. Okay, suppose ये बताओ कि अगर मान लो, suppose if you have a patient who is not having upper limbs, and you have to check the blood pressure, and you have to check the blood pressure, and after that you have to check the blood pressure, right? Now, okay, so now you tell me, is it possible that you can recheck the blood pressure over the ankle part or the knee part? Means suppose if a patient is there who is not having upper limbs, यानी कि उसके दोनों हाथ नहीं है, मान लो ठाकुर है patient, right? So now you have to check the blood pressure. Now you tell me, is it possible to check the blood pressure around ankle and knee? Yes, it is possible. So now if I ask you, okay, blood pressure जब check करते हो ना, when you are going to check the blood pressure over the elbow here, right? है ना, over the elbow, तो यहाँ पे कौन सा artery का check करते हो? यहाँ पे elbow में कौन सा artery का check करते हो? Pressure बताओ. एल्बो पे भी कर सकते हो, रिस्ट पे भी कर, रिस्ट पे कौन सा? रेडियल आर्टरी. यहाँ पे कौन सा बताओ? एल्बो पे पॉप्लिटियल. चलो एक बार देख लो, एक पूरा रिवाइज, बेसिक एनाटॉमी. जब भी अगर मान लो कि रेडियस पे, ओके, सपोज इफ यू आर गोइंग टू कीप cuff of BP apparatus, okay, BP apparatus over the wrist, तो यहाँ पे कौन सा? रेडियल आर्टरी करोगे, राइट ना? ओके फाइन. अगर यहाँ पे करोगे just above the elbow, you are going to check the pressure of which one? You are going to check the pressure of the brachial artery, fine. And just above the knee, which one here? You are going to check the popliteal artery, right? Popliteal artery. But above the ankle here, over the dorsum, यहाँ पे कौन सा करोगे? This one is the dorsalis pedis artery, and just here this part, okay, just at the medial malleolus, here at this position you are going to check the posterior tibial artery, okay, the posterior tibial artery. Okay, so can you tell me, A में बताओ ये कौन सा artery, कौन सा, ये बताओ, which artery is being palpated like in picture number A? अब तो बता दो, ये तो बहुत ही easy हो चुका होगा, अब तक तो याद हो जाना चाहिए, right? अब बताओ कौन सा artery है ये? A में कौन सा करोगे? A is the dorsalis pedis artery, right? A is the dorsalis pedis artery. What about B? B में बताओ, B में क्या है? B. Very good. What about B? B is the posterior tibial artery. Okay. I hope this is clear to all of you. आगे बढ़ते हैं. चलो ठीक है. Okay, last question for you people now. Which of the following structures may not be affected by indirect inguinal hernia? Basically, this is a question of surgery, but I'm asking you in anatomy questions. So I hope you understand the meaning of the indirect inguinal hernia. Indirect inguinal hernia क्या होता है? कि whenever abdominal content is going to pass through the inguinal canal. Inguinal canal अगर मैं यहाँ पे बनाऊँ ऐसे, है ना? Inguinal canal, if I'm making here. Inguinal canal, okay, how much is the length of inguinal canal? 4 centimeter long, right? 4 centimeter. Okay, this is the deep ring. Okay, this is the deep ring, and this is the superficial ring, right? This is the superficial ring. Okay, fine. So what is happening here? Whenever the abdominal content is going to pass through the inguinal canal, and after that this will go down. Okay, so what is happening here? See, after that, what is happening here? Inguinal canal से pass हो रहा था, वहां से कौन सा structure pass हो रहा है? Okay, spermatic cord, right? Spermatic cord, right? No, so basically I'm talking about the cord. So all the structures which are being passed through the spermatic cord, these structures will be, okay, now these structures may be damaged, right? No, so but okay, the structure which is not passing through the inguinal canal, which is not passing through the spermatic cord, okay, that might be safe here, right? So what is your answer here? basic anatomy. I hope you remember the content of the spermatic cord. Okay, see the vas deferens है वहाँ पे, yes, testicular artery है, ये nerve है, yes, prostatic plexus वहाँ पे नहीं है, right? No, so answer will be D only, right? Answer will be D only, right? Okay, so that's all for today. Okay, that's all for today. Next Sunday we are going to meet. Next Sunday date is, today is 26th. No. So, okay, so we are going to meet on 3rd November now. Okay. Okay, so next Sunday we are going to have the discussion of the pharmacology, super 30 questions of pharmacology. Achha, next month is October, right? Yeah, October. Pharmacology. Sorry, October, right? October. Okay, fine. So next Sunday we are going to meet again, like at the same time, and we will be having 𝗔𝗔𝗔 clinical case discussion. Chalo, okay then. See you next time. I hope this lecture, I hope this class was helpful for you people, and you learn in this manner, because like all of you who are preparing for the exam, upcoming exam, like in December, 12th December. So whenever you are learning non-clinical subjects at that time, I would suggest you that whenever you are learning non-clinical part, like at that time, you have to memorize each and everything. And whenever you are going to learn the medicine and surgery, at that time, you have to learn in that manner that you are going to integrate each and every part of the non-clinical part, right? So whatever you have learned in the anatomy, physiology, and the pathology, you should be able to correlate when you are learning medicine and surgery. Fine? Okay, then, chalo, theek hai. So this PDF will be shared in Arise group. Okay. Okay, then, chalo. See you next time. Bye-bye. Take care, all of you. Good night. Okay, thank you so much. Thank you so much. Bye-bye.